my name is Stephen Mortazavi, and I'm a pain management specialist from Bethlehem, Pennsylvania. What I'd like to do is talk to you today a little bit about lumbar herniated discs. I'd like to explain some of the treatment options that we have in our facility to treat patients with herniated lumbar discs. I'll be showing you some images of what these herniated discs look like, and then I'll be showing you on anatomical models some of the techniques and approaches we can do to treat these conditions. Herniated lumbar disc is defined as a displacement of disc material, either nucleus pulposus or annulus fibrosus, which is the inner or outer portion, beyond the intervertebral disc space. The highest prevalence is among people aged 30 to 50 years old, with a male to female ratio of 2 to 1. There is little evidence to suggest that drug treatments alone are effective in treating herniated discs. The incidence of herniated discs is ubiquitous, meaning extremely prevalent, with 19 to 27% of the general population, even without symptoms, having disc herniation found on imaging studies. Risk factors for disc herniation include smoking and weightlifting. Symptoms of herniated disc can include back pain, with or without leg pain, numbness, weakness, or even bowel or bladder issues. You may often hear the term herniated disc or degenerated disc. Herniated disc, as shown on this diagram, is a bulge of the disc or extrusion of the disc material beyond the normal confines of the disc. This is associated with younger patients. The symptoms are more acute in onset, and the patients are more likely to have radicular or sciatic leg type symptoms. Degenerative discs, shown lower on this image, are more associated with an older population, primarily with back pain and more gradual in onset. You'll see that degenerating discs generally have loss of disc space, which progresses as the disc degeneration progresses. This image shows a herniated disc on the left with an MRI representation on the right. Within the disc is known as the nucleus pulposus, which is like a gooey, white, uncooked, gelatinous crab meat material. When this material leaks out and extrudes and makes contact with the adjacent nerve root, inflammation can ensue, as shown by the red area on the nerve root and corresponding pain going down the buttock or leg. Sometimes herniated disc can actually break off from the parent disc, which we call extruded or even sequestered lumbar herniated disc, which is shown on this diagram. The red arrow above shows the extruded disc, whereas on the right side, the red and white arrows show such disc extrusion on an MRI image. Okay, so we've seen some pictures of what herniated and degenerative discs look like, and now I'd just like to show you on an anatomical model what that may mean as far as how we can treat these conditions. If you look at this spine model here, this would be the back of the patient, the buttocks, and the front or the stomach. We can see here the red portion of the spine refers to what would be a herniated disc. Okay, and you can see that the disc herniation is in close proximity to the nerve right behind it. And that's why when these discs herniate, they can lead to a lot of irritation and inflammation on the nerve root. And that can lead to sciatic type of symptoms. So what we can do is deliver anti-inflammatory medications above and below the herniated disc in an effort to reduce some of the swelling and pain on the nerve root and alleviate some of the sciatica or radiculopathy. And how we do that is essentially we have patients come in, lie down on this table, we position a fluoroscopy machine over their back, and we're able to basically look inside of them, almost like the airport machines can see through the suitcases. And through the use of these images that you see on the screen here, we can deliver the needles above or below in precise positions to deliver the proper medication on the hernia. the medication